Hi, did you know that the brain plays significant roles in balancing out blood sugar levels throughout the day? So when you're looking at patients that have had traumatic brain injuries or people that have neurodegenerative diseases, there's actually changes that occur in the brain that have a far-reaching effect on their ability to keep blood sugar levels stable. And keeping blood sugar levels stable allows you to have constant energy throughout the day, allows you to have ideal blood flow to your brain, to your tissues, to your heart, to all your organ systems, and for you to be really functioning at the highest level. Well, when people have various types of injuries at certain locations in the brain or neurodegenerative changes in certain areas of the brain, their ability to keep their blood sugar levels stable really become impaired. So we know that patients that suffer from traumatic brain injury often get what's called dysautonomia. This happens in about 50 to 60% of patients that suffer from a traumatic brain injury. And what happens is they injure areas of the brain that are controlling autonomic functions throughout the body. So they end up having this uh, neuroendocrine disruption really impacting their blood sugar levels. A lot of these patients are totally overlooked in the healthcare system, and they walk into the healthcare system with this roller coaster ride of chronic blood sugar symptoms. But since people don't understand this relationship between past head traumas and how it can impact blood sugar disorders, they can never really identify the cause, and then therefore they can't find an effective treatment for them. Also, another common imbalance is changes that take place in early Alzheimer's disease. In early Alzheimer's disease, there is degeneration first in an area of the brain called the medial temporal lobe or the hippocampus. And this area of the brain really is involved with controlling cortisol rhythms throughout the day. And when this area starts to degenerate, there's actually imbalances in the adrenal cortisol profile test. And they've done studies where they identify patients that have dementia, and they can predict their cognitive decline over time as they see these rhythm levels disrupted. This is because the medial temporal lobe is really involved with not only memory and recall, but control of circadian rhythms. There's lots of intimate connections and relationships between the brain and blood sugar stability, and we're going to go over this as well as other connections between the blood sugar system and the gut and the liver and adipocytes and vicious cycles that take place in the Kharrazian Institute course, Diabetes, Dysglycemia, Clinical Strategies and Treatment Applications. Hope to see you there. Thank you.